Hello everyone, I am Novia Nurain, a health informatics PhD student at Indiana University. Today I am going to present our paper, Older Adults' Experiences of Autonomy During COVID-19 Pandemic. COVID-19 pandemic has captured our attention throughout the last year. According to New York Times, around 30.9 million COVID cases have been reported till April 6, 2021. The number is even worse for older adults. According to CDC, 8 out of 10 deaths have been reported among people aged 65 and above. Around 45% of US older adults mentioned that they have experienced major changes in their lifestyle due to the pandemic. Older adults are facing even more challenges. They are at higher risk of having adverse outcomes. They use less technology and rely more on in-person interactions and services. Furthermore, disease mitigation efforts such as social distancing and self-quarantining have impacted their autonomy. In this paper, we investigate how older adults' experience of autonomy is influenced by the COVID-19 pandemic. To answer this research question, we conducted semi-structured interviews over Zoom with 15 older adults living in community dwelling in Bloomington. We analyzed our collected data using thematic analysis. Our findings have uncovered several factors of autonomy. First, we will talk about the requirements of autonomy. Participants mentioned that having technological competence, own transportation, financial security, and decision-making power allowed them to have a sense of autonomy. For instance, one participant mentioned that she knew how to use computer. She is able to participate in online social activities during the lockdown. Then we have identified 4 factors that hinder the feeling of autonomy during the pandemic. The first factor is government rules and regulation. One participant mentioned that she's not able to go anywhere due to stay-at-home orders unless it is to get food or to go to doctors. The second factor is lack of control. Participants mentioned that the uncertainty of the pandemic situation impacted their decision-making process. The third factor is influence from others. One participant mentioned that her family and friends did not allow her to go to the grocery store just to protect herself from the virus. And the last factor is perceived risk of getting infected. Participants mentioned that even though the churches have started their in-person activities, they are not attending those as they fear to get infected. Finally, we have seen tensions between support seeking and autonomy. However, older adults compromise autonomy to ensure their safety. For instance, we have seen that participants didn't want others to make decisions for their grocery, but when it comes down to health risk, they are willing to let others buy groceries for them. Based on our finding, we have provided design consideration for potential socio-technological support systems for older adults. Systems could be designed to enhance older adults' experience of autonomy by providing them more agency. For example, a system that allows older adults to choose items in a store using synchronous video or VR. System could also be designed around trust building between the older adults and unknown people who will be making purchasing decisions for their grocery. For example, assignment of the same people to deliver grocery to a specific older adults. Then over the time, they will be able to understand older adults' preferences. In conclusion, in this paper, we have explored older adults' experience of autonomy during the pandemic. We have identified several factors of autonomy and provide design suggestion for future socio-technological support system. Thank you all. If you have any further question and suggestion, please reach